Alright, so we're going to demonstrate a lady's slimming on the legs. The goal here is to tighten up the loose skin that was caused by rapid weight loss. So we're going to start with just a few minutes of heat. What the heat is going to do is it's going to stimulate the fat cells to break up a little bit. That way when we start the freezing process, when they're broken up, they can crystallize a little bit better. So we just apply some smooth heat. Just get the area kind of nice and warm and relaxed. Move along here. So this first round of heat is about 3 minutes. Then it's going to automatically switch to cold. And that's when the slimming starts. So the difference between slimming and fat freeze you want to use on an area that's stubborn, fatty, and inside of, some loose skin. Slimming is meant for tightening baggy loose skin, and toning is meant for tightening loose skin with good underlying muscle, which brings definition to the area that you're toning. So ultimately the goal right here is to, over a session of about maybe 10 sessions, tighten up the skin around the quads, giving for a nicer look, nicer shorts look. Short season is coming up. How much longer here? We've got about another minute and a half of warm. How does the warm sensation feel?
Feels fine. It's not too hot. It actually feels nice, like getting a hot stone massage.
Yep, so like I said, it's relaxing the area, and essentially it's spreading out the fat cells a little bit. About 10 seconds, it's going to switch to cold. So here we use a nice, slow, deep pressure. Ultimately, we want to get the skin down to about 2 degrees Celsius to maybe 0. And that's going to stimulate the skin to contract. And it's going to produce collagen, and it's going to put elasticity back into the skin. So I try to keep a nice close eye on the machine here, because it tells me the temperature of the skin.
And it doesn't really feel super cold. It almost feels like just like a little ice pack on there.
Like a moving ice pack. So the skin is cooling down at a nice rapid pace, which is good. That's an indication that we have some good underlying muscle. Sometimes if it takes longer to cool down, that means there's more fat that needs to be broken up and broken through. Is it painful at all when I'm
No,
losing pressure?
Not at all, just a little cool.
Based on the different services that are offered, technique plays a big role, as well as the temperature that we're trying to get the skin to. So with slimming, It's slow, deep strokes, and then nice and relaxed on the way back down, which is going to cause the skin to lift. Here, it's a little bit warmer, and that's because it's a little bit of a more fatty area up towards the upper part of the inner thigh, which is a common area of concern for a lot of us women. So we got a little over 20 minutes left in the cold section. I want to give the cold section plenty of time, because that's going to help crystallize the fat cells even more, produce more collagen, ultimately getting more elasticity back into the skin. When you're doing anything involving skin tightening, recommended frequency is about 2 times a week. Anytime you're working with freezing fat cells and destroying underlying fat, that you want to give about 2 weeks in between, anywhere from 10 to 14 days, depending on activity level. Have you noticed a difference in your workouts since we've started the skin tightening? As far as like it feeling better, less painful, maybe more endurance? I know it's hard to tell because you're a personal trainer.
Yeah, I work out pretty frequently, so I haven't noticed a huge difference. Maybe a little less fatigue in my quads.
Less fatigue is definitely one that I've experienced also. So I've been doing fat freezing. I've done it on several different areas, and I've noticed exactly like she said, less fatigue while you're working out. Me personally, I feel stronger in the area. I feel like I can engage my muscles more where those, fat cells have been frozen. It takes a few weeks for the results to really show, because it takes some time for your body to break them down and flush them out. Sometimes the area can still be swollen for a little bit after too, because your body's just kind of getting used to it. So the temperature of the wand is set at 0 degrees Celsius. When you're doing fat freezing, the wand is set anywhere from -4 to all the way down to -18 degrees Celsius. So the difference in temperatures depends on how deep you're really trying to freeze. And as I explained, in this case, we're working more with skin as opposed to freezing fat. There's not much fat on the legs here to be frozen. It's more just really loose, saggy skin. So with the Cryo T-Shock, this is a service that we provide, which you can't necessarily get with, competitor services like Cool Sculpting. Cool Sculpting really is strictly just freezing fat cells, and it actually has a suction of sucking the skin, which in theory helps to break up the fat cells a little bit. But with modern technology, we've found that the better form is a thermal shock, which is why we apply heat and then cold and then heat. So right now, like I said, we're at 0 degrees, and the skin is about 1 degree Celsius. So this machine is manufactured by a company named Pagani, which is an Italian manufacturing company that actually manufactures devices, medical devices. And the Cryo T-Shock originally was a medical device that has been passed on as an aesthetic form of non-invasive surgery, like tummy tucking, freezing fat cells, facelifts, and it's a much more affordable option than the invasive liposuction, and even cool sculpting can get pretty pricey. The good thing about the Cryo T-Shock is that, you know, it's one session at a time. You can kind of stop at any point. You can keep going if you feel like the area needs more. Typically recommend suggested number of treatments per body area is about 5, but that depends on the person, depends on size, also depends on activity level. So we got about 10 minutes left on the heat. I'm sorry, on the cold. And then it's going to switch back to heat, which will cause the thermal shock effect. It's suggested that after treatments, it's good to get in a 30 to 60 minute vigorous workout, lymphatic drainage massage, sauna. Or you could simplify it and do something like vibration. So vibration gun, which I have. You can roll out the area. Sometimes, if necessary, we can expand the service a little bit more and do drainage in the area, which essentially is an additional 5 minutes of cold, 5 minutes of heat, 5 minutes of cold, 5 minutes of heat, and 5 minutes of cold.
So after I lost my weight, the inside of my leg here has been like, in the saggy skin, is really a sore spot for me. And I didn't want to do anything invasive as far as surgery. So this is a great alternative to that. I can get up and go to work this afternoon and not have a problem, no downtime. And after just a couple of sessions, we're already starting to see a little bit of a difference. So I'm very optimistic about this as a good alternative.
That sounds great. Not only is it an alternative, it's an affordable alternative, which is the best part.
Well, I think one of the things I like about it too is it's non-invasive, it's not painful at all, and I can, like I said, I can get right up and go to work or go work out or go about my day without any downtime or pain or anything at all. No scars, no anything from
No incisions.
surgery. Don't have to worry about infection from surgery or any of that.
Or stretched out skin. Like I said, cool sculpting involves a suction, which can tend to leave a pocket of skin. So we're down to the last 2.5 minutes. I can actually already see some lift in the skin as I'm working. So this is specially formulated gel that doesn't crystallize under cold extreme temperatures, which is what we're trying to get the skin at. Okay, so the last heat cycle has started. This, like I said, is going to apply the thermal shock. I would say another way to increase the results would be compression in the area. So some sort of compression pants or compression belt for abdominal work. That will help keep the frozen cells together, making it easier for the body to flush them out. And making it, when the skin gets back to a normal state with the compression, that's going to help the skin tighten up even more. So we've got about 30 seconds of heat left. Looking at the screen, the skin's up to about 38 degrees Celsius, which is exactly where we want it to be. Alright, so now that we are done with one leg, we have to switch around and do the opposite leg.